In this video, we are going to study the insomnia. Insomnia is a general term to describe sleep disorder, which the patient either have trouble in falling asleep or staying asleep. Sleeping, from the basic theory, we understand from the perspective of the heart-mind. So in order to sleep, the heart-mind should be calm. So if the heart mind is not calm, it disturbs the heart mind. The patient may present as insomnia or dream-disturbed sleeping. So when we discuss the heart and mind, we always use the image on top, the fish in the pot. We think that the heart and mind is like the fish. In order to make these fish become, we need at least two aspects. Firstly, we need to have sufficient water in the pot. Second, the temperature shouldn't be too hot. So now we just imagine that under the pot there's a fire. So when the water become hot, the fish also won't be calm. So that's also another reason for insomnia. The water, from our theory, this ink can be either fluid, the hot fluid, hot ink. So we talk about the heart and mind, but in order to keep the heart and mind stable or calm in the heart, we need a heart ink. The heart ink can be the fluid in the body. If we don't have enough heart ink, it will be ink deficiency. So this ink deficiency, especially the heart ink deficiency, the patient may present as insomnia. Another category of ink is the blood. So if the patient presents as heart blood deficiency, that's also the reduced water in the pots. The patient also may present as insomnia, so that's blood deficiency or ink deficiency, but that's mainly related to the heart. But where does the ink come from, the fluid or the blood comes from? This will come from the spleen, the middle jaw. So the spleen deficiency may result in the malnourishment. It also may related to the insomnia, the spleen. From 黄帝内经, it described that if a patient suffers from spleen and stomach problem, they may present with insomnia. So that sometimes a patient comes to you with insomnia, but you need to treat from the spleen and stomach, especially if this patient suffers from insomnia accompanied with abdominal pain, abdominal fullness. So you can treat them together because the spleen will also affect the heart mind. And then the fire here. What's the fire in our human body? That's the heat. The heat can be the kidney, can be from the kidney. You also can from the liver. The liver fire or the kidney ink deficiency with deficiency heat. And then the deficiency heat will affect the heart. So the kidney and the liver also may affect the insomnia. The spleen, the dysfunction of the spleen may result in phlegm, with internal phlegm. Stagnation of the phlegm may result in internal heat. So that also may contribute to the heat. So according to these explanations, you will understand that insomnia, from acupuncture point of view, many focus on the heart. The heart is one of the most important organ that's responsible for the insomnia, but it also related to the liver, kidney, the spleen. For example, a patient presents very commonly. A patient presents with insomnia. Some of them, anxiety, depression, or anger or poor temper. So especially anxiety, that very commonly happens with insomnia. That's liver on the emotion. Overthinking may result in qi and blood deficiency, also may affect the liver. So for our treatment, we're also going to consider these aspects. The main organ is the heart. The main affected organ is the heart. But in the meantime, we need to focus on the spleen, the kidney, or the liver, depends on individuals. The syndrome differentiation. Firstly, the main syndrome, the main symptom, difficulty in falling asleep or staying asleep, easily wake up, and very difficult to fall asleep again. The patient may present as accompanied with headache, dizziness, palpitation, poor memory, dream disturbed sleeping, etc. So according to the different causes, they may be diagnosed as different syndrome. A heart and spleen deficiency, dream disturbed sleeping, wake up easily. Because the spleen and heart, so you must find something related to spleen. Apart from these manifestations, as you can see, all these manifestations are related to the heart. So you need to add all the fatigue. The patient also may present as tiredness or heaviness in the extremities. Loose stool. Apart from these manifestations, such as loose stools, that's one of the most typical symptoms for spleen deficiency. Heart and gallbladder qi deficiency. When we see gallbladder, one of the most typical symptoms is fear. Some patients they may feel fearful. Sometimes the patient will tell you that that kind of feeling that they feel like they are afraid of something, but when you ask, what are you afraid? They don't really know what do they afraid, but they feel fearful. So that's from gallbladder deficiency. For our treatment, we're going to strengthen gallbladder and plus the heart. Dream disturbed sleeping. This is from the image from the previous slide, the fish and the fire. The dream disturbed sleeping in the theory, we actually understand from the fish. The fish is moving very fast, it's not calm. So we need to calm the heart mind. Dream disturbed, because when you dream, something is moving. So that's the heart and mind is moving. Excessive moving. So we need to calm the heart mind. From qi deficiency. In deficiency with deficiency fire or deficiency heat, irritation, feverish sensations. That's very typical in deficiency and deficiency heat. Hot flashes, dry mouth, less coating because you don't have enough fluid in the body. So the coating, the grasses on the tongue is not growing. Internal fire due to liver stagnation. This is liver qi stagnation. So the patient still irritation, the poor temper, and then yellow, bitter taste. Bitter is the taste of fire. Yellow urine, red tongue, these are all internal, or the heat. Internal flame, when you see flame, the patient may cough phlegm, but that's not common. Most of the situation, they don't really have coughing or coughing phlegm, but when you see, you will see the yellow greasy coating, especially greasy coating, chest tightness. So from this point of view, in this internal phlegm, sometimes it's the invisible phlegm, not the physical phlegm you can see. Perfumes phlegm. This is not has to be. It may or may not. As long as this patient presents as greasy coating, or in some situation, if you cannot diagnose any other symptoms, the patient didn't present as any typical symptoms of specific syndromes, you also can treat from the phlegm. That's the law, or the principle in Chinese medicine. The weird diseases you can treat from the phlegm, because that's the characteristics of phlegm. Phlegm can cause weird or variety of diseases, especially the one you cannot explain. Then we can treat from the phlegm. This may due to the invisible phlegm. Treatment principles: harmonize the yin and yang, calming the mind. So calming the mind is very important. Harmonize the yin and yang. That's the principle in Chinese medicine for sleeping. In Huangdi Neijing and other texts, described that when we sleep, the Wei defensive qi supposed to go to internal body. During the day, it goes to superficial body. So the Wei defensive qi is yang. It describes that when we sleep, the yang will enter the yin. If the yang can enter the yin, it means the harmonize of the yin and yang. If the pathway blocks, it will cause imbalance of yin and yang. That's disharmony. That's why harmonizing the yin and yang. For the treatment, it will depend on specific syndrome. For deficiency, we can do tonify. For excess, we can do reduce. So we're going to select different technique and principles for specific syndrome. For internal heat or deficiency with deficiency heat, preferably we don't use marsupial, but you can use acupuncture. The main points: heart 7, pericardium 6, do 20, room 4. As you can see the characteristics of these points, some are the yuan source points, some are the points to strengthen the qi. Spleen deficiency, you can add bladder 15, bladder 20, spleen 6. Spleen 6 is the meeting point of 3E meridian. 3E meridian they course through spleen 6, so it can strengthen the spleen meridian, the spleen organ. The gallbladder, you can add the bladder meridian, the backsu points on the bladder meridian, because these are the zang organs deficiency. We have mentioned quite a few times that for deficiency, especially the zangfu organs deficiency, we can use the backsu points on the bladder meridian. But for the excess, we will choose the front mu points. GB40. Why we can use GB40 for insomnia? So this is one of the questions you need to answer. Apart from these points, there are other points such as Zhaohai. going to check the number, 照海, and 升脉 on the bladder meridian. These 2 points we also can use for insomnia. But why? I also want you to think about these 2 points, why we can use for insomnia. Okay, apart from these points, for yin deficiency, you can use kidney because we're going to strengthen the kidney, the liver, especially with deficient heat, you can reduce liver 3 to reduce the heat. Indian 1. Internal fire due to liver stagnation. Level 2, level 3, gallbladder. For phlegm, we can use Summer 40. Sorry, Nating is not pericardium 6. This is Stammer 44. Stammer 44, yes. So we're going to, because of the phlegm, we're going to focus on the specific points that can clear the phlegm, or the stomach meridian, or the spleen. So Nating is Stammer 44. So these are the points that we can use. Round 12, that's the meeting points of 4 organs. The internal phlegm will affect the organs, and the phlegm, we're going to focus on the spleen, because we have described in the basic theory, where does the phlegm comes from? That's from the spleen. Although the phlegm may come out from the lung, but we think that the lung is only the container of the phlegm. Where does the phlegm originally come from is the spleen. The spleen and stomach. That's why we need to focus on the spleen and stomach. And then in the meantime, you can treat the internal organs, because the spleen and stomach, also especially the stomach, is 4 organs. If it is possible, you can apply the treatments in the late afternoon or even early evening. Sometimes for acupuncture treatments for insomnia, acupuncture is actually quite effective for insomnia. In some situations, the patient may fall asleep during the treatment. Very commonly, if the patient, especially the patient, if they don't feel too nervous about the needle, they may fall asleep during the treatment. So in this situation, although we have studied the manipulation, different type of manipulation techniques for insomnia, sometimes we don't want to disturb the patient during the session. So in some situation, we don't do any manipulation during the treatment. So you can have the manipulation at the beginning and then in the end. So in between, we don't do any manipulation. We try to make the patient calm. If they can sleep, that's even better. Other treatment technique, skin needle. Actual points do HN3, 太阳. Actual points you also can use. Auricular acupuncture, you can select some points that are related to the heart. Spleen depends on the syndrome. You can select 2 to 3 points. For auricular acupuncture, you don't have to use needles, which means they keep 30 minutes. You even can keep longer if you use the seeds. So you can ask the patient to manipulate by themselves quite a few times a day. That's for auricular acupuncture. Apart from those points that we have mentioned, there are other points that you can consider, especially the extra points, such as yin tang. So you're going to find the numbers by yourself. Yin tang, the 四神聪, the 4 points around U20, actual HN1 might be 1, 是神聪. Anmian, also the actual points near your ear. Zhaohai and Shengmai we have mentioned just now. These 2 points, the Zhaohai and Shengmai, they are connected to the Yin heel and Yang heel meridians, the actual meridians. When you go back to the meridian differentiation, you will see the functions of these 2 meridians. They can assist in controlling sleeping and awake. That's why we can focus on the points of those actual meridians. When we use the Zhaohai and the points on the actual meridians, we also need to consider the reinforcing and reducing technique of these points. Acupuncture is quite effective for insomnia, but apart from the treatments, we also need to advise the patient to exercise, to change their lifestyle, especially if the patient presents as anxiety or stress, depression. They must to have some adjustments from the lifestyle to relieve the emotion through exercising. So this is some advice you can suggest. If the insomnia is caused by other diseases, secondary insomnia, then we also need to focus on the original disease, such as severe headache, fever, etc. So we need to focus on the diseases that cause insomnia. In this video, we mainly discuss insomnia. We should focus on the heart, the spleen, the liver, and kidney. But from the meridian perspective, we're also going to focus on the Yin heel and Yang heel meridians, these 2 actual meridians. Thank you for your attention.